Hello, my name is Jenny Malouf, and I will be presenting to you my project about the impact of socioeconomic status on the mortality rate of cancer in U.S. counties. The factors of the socioeconomic factors taken into consideration will be population estimate, the median income, the poverty rate, and the number of people with health coverage. Prior studies have shown that lung cancer, the prevalent cancer diagnosis, has a broad disparity between different socioeconomic groups. This is linked to a higher rate of unhealthy health practices in underprivileged areas, like smoking and higher stress levels. There's also a more frequent mistrust in the healthcare professionals and the healthcare systems in lower income areas, which is linked to less education and also less awareness about cancer. It's also prevalent in rural areas, which tend to be lower income areas. The variables are shown here. They are the poverty per capita, the median income, the health insurance, or having no health insurance at all, meaning even public health insurance. Having health insurance means private health insurance, as well as the incidence rate. The range in these variables also differ, as well as the kurtosis, which in here in these variables tend to be close to 1, but for the population estimate and the poverty without per capita means not divided by the population estimate, they have a higher kurtosis, which means a not normal distribution. You can see that the median income is correlated with poverty per capita, and also having health insurance is correlated with the median income and the poverty per capita. A good correlation of with the mortality rate can be seen with the median income. It's almost 0.5, so it's moderately correlated. And also the incidence rate is highly correlated with the mortality rate. And the population estimate is also correlated with the poverty variable, as we discussed. The falling trend is correlated with the poverty, and it's also both the falling and the rising don't have a lot of correlation with the mortality rate. To examine each variable with the target variable alone, I did the linear models for each one, and all the variables appear to be significant, and except for the rising trend. A higher poverty rate can mean a higher mortality rate, and the higher median income can mean a lower mortality rate, and so on. The coefficients presented were logical. Not having health insurance means higher mortality rate. Okay, this is the histogram of the mortality rate, and it's not very normal. It's a bit skewed to the right, so we will probably use a transformation on this variable. This is the pairs data, and the correlation matrix is confirmed. The incidence rate is correlated with the mortality rate, and the poverty variable is correlated with population estimate. It's also worth noting that health insurance variables would also be correlated with population, but these are the per capita variables, so it's not very. This is the importance of doing per capita, so that we don't have correlations with population. This is the residuals plot for the first model, the general one. The mean appears to be close to 0, and there are some outliers. The first model appears to the rising trend, and the all poverty don't have a lot of significance. However, when we remove the with the health insurance per capita variable, all the other variables will then have a significance, because I really didn't want to remove population estimate and falling and rising trends. However, I ended up removing the rising trend because it wasn't significant at all, and this is the model that I have. Also, the step AIC backwards function gave me this exact model as R squared of 0.73, and yes, all the p-values are less than 0.05. And this is the histogram of the errors. They appear to be normal, however, the tail is a bit wide. This is the residuals versus fitted model. The red line appears to be linear, and however, the model tends to overestimate a bit the low variables, the low mortality rates, and the normal QQ plot is not very, it's not very normal. This is the falling 1 versus the falling 0 graph. The falling 1 are the red dots, and the falling 0 are the blue dots. And they don't have much difference in the distribution of the residuals. After that, I did the square root of the mortality rate so that it becomes more normal. And previously, I didn't show the graph, but the ACF was showing a bit of autocorrelation, and this one doesn't. And this is the new residuals versus fitted. The normal QQ plot appears to be more having a more normal distribution of the residuals, and the residuals versus fitted appears to have more equality of variances. However, I did remove the outliers, and the red line was a bit not linear anymore, but I consider this model to be a better fit. And this is the summary of the model. The falling variable reduced in significance, but I still kept it. However, I removed the poverty per capita because it was not significant at all. This is I used this model to make a prediction on the testing set, and the testing set proved to have 84% of the actual values were within the confidence interval, and the confidence interval had a width of maybe 1.5 to approximately to for the square root of the mortality rate. I can conclude that the population estimate tends to have a significant impact, and the median income, as well as not having health insurance, and also the incidence rate. They all have significance on the mortality rate. So a person's location in a larger county can help him be diagnosed, have a better diagnosis, and therefore lower his chances of death from cancer. And also, a higher median income tends to mean that you have health insurance, and you also have better prevention habits for cancer. Thank you for listening, and I hope it was a good study.